So today I'm delighted to be speaking to Caroline Smith in the next of our series of speaker interviews in the run-up to Dentistry Show London, which is taking place on the 6th and 7th of October at XL London. Caroline is a dental hygienist and therapist with a special interest in functional medicine, and at the show she will be giving a presentation on dysfunctional breathing and its effect on oral health in the Dental Care Professionals Hub on Saturday, 7th of October at 3:45. So thank you so much for speaking with me today, Caroline.
Thank you for inviting me.
No problem, it's my pleasure. So at the show this year, you'll be speaking about the effect of dysfunctional breathing on oral health. So for those that don't know, can you explain what dysfunctional breathing actually is?
Yeah, sure. So I think, well, dysfunctional breathing it's an umbrella term. So there's lots of things that can fall under that category. So what I'll be focusing on is actually the first stages of breathing and the dysfunction in that area. So when the air comes into the body, so how is it coming into the body? Is that via the nose or via the mouth? We're designed to nasal breathe. So what I'm going to focus on is the dysfunction of nasal breathing and why some people are mouth breathing and what we can look for.
Okay. And how does dysfunctional breathing relate to oral health?
Yeah, so we know that the saliva is such an important component of the oral health because, you know, it's predominantly water, it's got proteins in there, it's got lysosomes which reduce that bacterial colonization. So if we are creating a dysfunctional saliva production, or if we are drying the oral environment out, then that's going to have an impact on the oral microbiome. Also, the mouth is the beginning of the digestive system, but actually digestion starts prior to that by smelling our foods. So if we're not actually smelling our foods and releasing those gastric juices, we're actually having an impact on our digestive system. And any impact on the digestive system will then have an impact on nutrient absorption, mineral absorption, which can then manifest as oral presentations as well.
Okay, that's really interesting. And how can dental professionals tell whether a patient has dysfunctional breathing?
Yeah, so it's really simple when we're talking about breathing nasally or mouth breathing, because most people know if they're a mouth breather. So you can ask about having a dry mouth. You can ask if they have, for example, disrupted sleep. They might wake with a dry mouth. There might be some snoring or disturbed sleep because the tongue potentially is, you know, not protected, and that can fall back into that airway space. We are in a position where we are looking at the patient from behind, so we can see any, potential deviation in the nasal septum, which we can talk about. We can also, just ask them, how do you breathe? And most mouth breathers know that they're mouth breathers.
And what should dental professionals do if they notice that a patient has dysfunctional breathing?
Yeah, so with regards from a nasal perspective, you really got to get to the root cause of why that patient is actually breathing through their mouth. So that could be, for example, like I said before, a deviated septum. So that needs to be referred to an ENT surgeon. If the dysfunctional breathing is having an impact on sleep and there's a potential apnea going on, then that has to go via the GP to the ENT, and there are different systematic pathways for that. If there is, there potentially might be some nasal allergies, or there might be nasal polyps, or it potentially might just be habitual. So you've got to get to the root cause, really. So it's working out kind of why that dysfunction is happening and sending them really to the right people for the right support.
That's really interesting. And I know you're also interested in functional approaches to health. So do you think that dental professionals have a bigger role to play in improving patients' overall health and well-being?
Yes, absolutely. Because like I said before, the mouth, it's the beginning of the digestive system, and then the back of the mouth is the beginning of the respiratory system. So, we can actually act as gatekeepers of the digestive system and the respiratory system. And we're in a very privileged position where we can look inside somebody's mouth. We can measure inflammation as a percentage. We can, you know, we can refer out to different practitioners if we're seeing any oral manifestations. We know that certain nutrients are needed for healing. So we can actually use, you know, food as medicine in that approach to that healing phase. And yeah, I think that the way that the health system is at the moment and the crisis that we're in, I think that dental professionals, I think there is a massive gap in the market where we can actually be supported, especially, you know, where the evidence is strongest, for example, with diabetes. You know, is there a way that we can actually home in on that really strong clinical evidence? Because a lot of diseases come from an imbalance in blood sugar. So I do think moving forwards, there is a huge potential for us to be part of the bigger, wider, you know, area where we can support those patients whole body.
Yeah, absolutely. That's really interesting. And then finally, apart from your own speaking session, what else are you looking forward to about attending Dentistry Show London?
Well, coming to London, as you can tell, I'm not from London. I'm from the north, and we don't actually get a lot of dental shows in Newcastle. We normally have to go to Manchester or Scotland. So I'm looking forward. I always look forward to coming to London. It's just really got an exciting vibe. So I'm really looking forward to that. I'm also looking forward to just pottering around the trade stands. I can, you know, it's amazing what little nuggets of different products and things that you can take home and back into practice. From a speaker's point of view, Prof. Chappell, I'm definitely looking forward to that one. So I need to be there early doors on Thursday for that one, because, you know, he's a massive advocate of whole body health, and, you know, he's really paved the way for younger clinicians to take that information and to run with it. So I'm really looking forward to that. And I'm also actually looking forward to the presentation by Joss Harding as well. I've met Joss a few times. She's come to watch me lecture, but I've actually not heard her lecture on mouth cancer. So I'm really looking forward to that one as well.
Amazing. Well, thank you so much for your time today, Caroline. It's been so interesting to talk to you and find out more about dysfunctional breathing. And I'm really looking forward to your session and to meeting you at Dentistry Show London in October.
Excellent. Look forward to it. Thank you.
Thank you.